Hi, Alex, how are you?
Good.
My name is Logan. I'm a nursing student. I'll be performing a neurological assessment on you today.
Okay.
Wonderful. Will you please state your first and last name and your date of birth?
Alex Bowman, 10/30/1998.
Wonderful, Alex. Do you have any allergies, anything I need to be aware of?
No allergies.
No? No allergies at all?
Nope.
Fantastic. I'm going to be performing a neurological assessment on you today. I'm going to be poking and prodding you, touching your skin, hair, face, making sure all your cranial nerves are functioning properly.
Great.
If I cause you any form of discomfort or pain at all, please don't hesitate to let me know, okay?
Okay.
My general assessment is my patient is sitting upright, seems to be of complete level of consciousness, doesn't seem to be any pain or distress, smile on her face, seems to be stated age, hygiene is appropriate, dressed appropriately for the weather. All right, Alex, I'm gonna ask you a couple questions now. Have you suffered from headaches in the past or currently suffering from a headache? No. Have you suffered from migraines in the past?
Yes.
Yes. And what causes these migraines? Are they food-induced, light-induced, stress-induced?
Stress-induced.
Stress-induced.
I usually have to sleep in a dark room, and I become blind and also vomit, and then that's when the big migraine comes on. So I have to sleep it off.
And how often do you experience these types of migraines?
Every so often when I get really stressed out.
Okay, like once a month, once every 2 months?
I'd say once or twice a year.
Once or twice
But
a
I
year.
haven't had a migraine in a couple years.
Okay, and do you take any medication for that migraine?
No.
Have you ever seen a doctor for that issue at all? No, not at all. Okay. Have you had a spinal injury or head injury in the past?
No.
Have you ever had a concussion from playing sports?
Not at all.
Wonderful. Are you experiencing any numbness or tingling in your extremities at all? No? Wonderful. All right, Alex, on a pain scale from 0 being no pain at all to 10 being the worst pain you've ever experienced, what level would you say that you're at right now?
0.
And is 0 your baseline?
Sure is.
Wonderful. We're now going to test your level of consciousness. Please state your first and last name.
Alex Bowman.
Where are you?
Logan's house.
Logan's house. What is the president?
Donald Trump.
Donald Trump is the current president. What month and year are we in?
November 2020.
+4 and O. All right, Alex. Now I'm going to test your cranial nerves. So first, I'm gonna have you squeeze your eyes tight. Yes, and now raise your eyebrows, puff out your cheeks. Perfect. Cranial nerve 7, facial nerve 7 checks out. All right, Alex. I'm gonna have you read this up here.
Motor skills.
Motor skills, wonderful. That would be cranial nerve 2, optic nerve. All right, Alex. I'm going to check your pupillary contraction. Perfect. That part of cranial nerve 3, ocular motor checks out. Now please follow this pen light. Keep your head nice and straight. Just use your eyes.
Okay.
Wonderful. Cranial nerve 3, 4, and 6. Ocular motor, abducent, and trochlear all check out. I'm going to touch your face now, Alex.
Yeah.
Keep your eyes closed. Let me know which section of your face I'm touching, okay?
All right. Forehead, cheek, chin, cheek, forehead, chin.
Wonderful. That would be her trigeminal nerve, and that would be nerve 5. It checks out. All right, Alex, close your eyes for me again. Now I want you to wave your hand when you hear the sound in whichever ear that I'm on. So if you hear on the right side, wave your right hand.
Right.
Perfect. Cranial nerve 8, vestibular cochlear nerve checks out perfectly. All right, Alex. I am going to have you open your mouth and say ah. Uvula is midline. Stick out your tongue for me. Move your tongue left. Move your tongue right. Perfect. And now say light, tight, dynamite.
Light, tight, dynamite.
Wonderful. Glossopharyngeal nerve, hypoglossal nerves checks out. Vagus nerve, so that is 9, 10, and 12. Now, Alex, I'm going to use your shoulders, put them back down. Perfect. Cranial nerve 11 accessory is functioning properly. All right, Alex, I'm going to have you take your thumb and touch all your fingers like this. Fine motor skills checks out. I'm going to put your hands on your thighs, now flip them over, nice and quick. Gross motor skills seem to be functioning properly. All right, Alex, I'm going to have you put your arms onto your side here, and I want you to touch your nose. Perfect. Her motor skills seem to be intact. Gross motor skills functioning. Cerebral functioning seems to be in line. Okay, Alex, now what I'm gonna have you do is I am going to have you close your eyes.
Okay.
And I'm with your hands up for me, please.
Mm-hmm.
And I am going to place an object in your hand, and I'm going to have you tell me what that object is, okay?
Sounds great.
So here's,
That's a pen.
okay, and
It's a piece of paper.
it's a piece of paper, wonderful. Stereognosis checks out perfectly. All right, Alex, I'm gonna have you close your eyes and keep your hands up. Now I'm going to draw a letter in this hand facing you. Please tell me what that letter is.
A.
Perfect. I'm gonna draw a number in this hand. Please tell me what that number is.
6.
Perfect. Graphesthesia checks out. All right, Alex, I am going to test your sensory here.
Okay.
So I'm going to poke. This is sharp.
Mm-hmm.
This is dull.
Great.
I'm going to do this on your arms and your legs. So close your eyes and tell me if it's sharp or if it's dull, okay?
Mm-hmm. Sharp, dull, sharp, sharp, dull, 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 sharp, dull, sharp, sharp, dull, sharp, dull, dull, sharp, sharp, dull,
Hold your legs here.
sharp, 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 dull, dull, sharp, sharp, dull, 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 sharp, 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 sharp.
Wonderful. Sensory perception seems to check out. Recognizing dull and sharp sensations. All right, Alex, I'm gonna have you hold your arms out nice and straight for me and close your eyes. Musculoskeletal system checks out, no drifting of any kind. All right, you can put your hands down now. All right, perfect, Alex. I'm gonna have you put your hands on your, just relax your hands. I'm going to push your finger up or down, okay? So tell me if I'm pushing up or if I'm pushing your finger down, okay?
Perfect.
I'm gonna do this on your hands and toes, okay?
Up, down, up, down, up, down, up, up, down, up, down, up, down, down.
Perfect. Tactile sensory perception of the fingers and toes seems to be intact. All right, Alex, I'm gonna have you stand up for me, please.
All right.
I'm gonna have you close your eyes, hands by your side. Perfect. Lomberg test is negative. Open up your eyes, Alex. I'm gonna have you heel toe in a nice straight line. Balance and proprioception also seem to be intact. All right, Alex, please have a nice seat for me. And now I will be testing your deep tendon. And, all right. Tendon response is not elicited. This sign, bilateral both arms. All right, no tendon reflex response elicited on either of the knees. All right, Alex, thank you so much for your time today. Please enjoy the rest of your day.
Thank you.